Hi guys, I understand that part of this got cut off, so I'll start back with non-surgical management. Um, Complementary and other therapies are sometimes used with breast cancer. Look at table 70-2 on page 1447. To help cope with the physical and emotional aspects, a lot of times people use some integrative therapies such as yoga or acupuncture to help with pain and anxiety reducing. But this should not be done in place of standard therapies. Non-surgical candidates a lot of times will choose to have some systemic chemotherapy or radiation therapy or a combination. And this is sometimes done even if the patient is considered for hospice or palliative care, because sometimes with different therapies, the patient can have some relief, like from pain. Some radiation therapy a lot of times will decrease nodules and decrease their pain as well. So a lot of times radiation therapy will be done for patients with increasing pain, even if they are in palliative care. Surgery for breast cancer can be several different surgeries are done. There is the breast conserving surgeries, which are the lumpectomy, which is the removal of the breast and a small amount of tissue. The partial mastectomy, which is where the tumor and some normal tissue is removed. A total mastectomy is where they remove just the breast tissue. And a modified radical, which is what you see a majority of the time in anything that is more than a stage 2 or 3, or excuse me, stage 2, you would see the modified radical, because they generally will take a few lymph nodes. Unless it is truly a stage 4 cancer, they generally do not need to take part of the chest wall. There's pictures of these surgeries on page 1448, and it shows you the difference on how they do a lot of those different mastectomies. Okay? Keeping in mind that the lumpectomy is done a lot of times for tumors that are more easily approximated, but the modified radical is what they do when they remove some of the lymph nodes as well. Preoperative care, a lot of times we have people called breast cancer navigators or breast navigators, and they're nurses who come around and talk with the patients preoperatively or meet with them in the oncology center. They help to relieve anxiety. They provide information to increase the patient's knowledge to decrease their anxiety. They include their spouse or their partner if the culture permits or if the patient desires. A lot of times spouses don't want to be made aware of what's going on, and they'll have another support person instead of their spouse. You also want to make sure that you go ahead and give postoperative information, such as care of drainage tubes, such as the Jackson Pratt, where the incisions will probably be located, mobility instructions, and go ahead and go over their post-mastectomy exercises that are listed in chart 70-3. You also want to go over general preoperative and postoperative information with these patients. Postoperative care for the mastectomy patient, you want to make sure that you avoid the affected arm for blood pressure injections or drawing blood. You want to assess the Jackson Pratt tubes to make sure that they are not clogged and that they are still compressed, and make sure that you're emptying them often. If the patient has had reconstructive surgery, you want to assess the skin flaps and keep the sites warm. Please refer to tables 70-3 and 70-4, and make sure that you look at the action alert on page 1448 for the JCAHO recommendations of mastectomy care for surgical site infections. It's important for these patients postoperatively that they keep the head of the bed at 30 degrees, that they elevate the affected arm, and that they have their pain control managed. These are things that are important for postoperative care. Other things that are important is your coughing and deep breathing, and making sure that they are getting up early for ambulation. Coordinating the care of the patient postoperatively and transitioning to home. Remember, these patients need general postoperative care, such as DVT prophylaxis. They need to have coughing and deep breathing. We need to watch for drainage, especially out of those Jackson Pratt drains. Again, make sure you look at the action alert on page 1448 for the surgical site infections. And then The following charts are really great information. They're good for both home and hospital care, and you see those listed there. I would make sure that I looked over those as well. And that's it. Sorry we had to do a redo. Thank you.